So good morning and welcome. I would first like to acknowledge that Thunder Bay Regional Health Sciences Centre operates on sacred land. We are on the traditional lands of the people of Fort William First Nation, territory to the Anishinaabe Nation, and home to the Robinson Superior Treaty of 1850. Today, Thunder Bay is home to many Indigenous people across Turtle Island, and we are grateful to have the opportunity to work together in this community and on this territory. So good morning and welcome. I would like to first take the opportunity to welcome our special guest, Member of Provincial Parliament, MPP Kevin Holland. Welcome, Kevin, who's joined us today for this exciting announcement. It's really nice to see you here this morning. So now to talk a little bit about healthcare. As you know, healthcare challenges, in particular in the Northwest, are truly systemic, meaning they have been around in one way or another for decades. With an aging population and the pandemic, we've certainly seen some of those systemic challenges been brought to the forefront, especially when it comes to alternate level of care and the challenges within organizations and patient flow. So true to our vision of exceptional care for every patient, every time, and our commitment to quality as an academic health sciences center, we're always looking for opportunities to enhance and promote safe and quality care while making sure patients receive the right care in the right place and time. So today's announcement brings us closer to that exceptional care experience by enabling care beyond the core needs of our patients. In total, we are receiving $1.29 million to support our patients, to improve patient flow, and to assist in safe transitions to home. These funds will complement our existing care by having a dedicated planner and kinesiologist to support patients within our transitional care unit. So by providing these additional rehabilitation support, the kinesiologist will be able to provide patients with assistance with mobility, function, and physical performance, which really improves patients' functionality and helps them to go home more quickly. The additional supports of having a dedicated planner will also provide dedicated and improved better follow-up for discharged patients to ensure they have clear directions when transitioning to home, prescription compliance, and home care services are in place. So people now have more options and fewer barriers when leaving our hospital, enabling improved services, supplies, or any equipment a patient may need. So now, before I turn it over officially to MPP Kevin Holland, I would really like to thank all of you for coming out today, and for MPP Kevin Holland for leading the charge and really helping to support our hospital, our community, our patients, and our families. And I also wanted to comment and mention our staff, who have certainly been working tirelessly to ensure that patients receive the right care at the right place and time. So on behalf of our patients, I want to thank you for your determination in helping us to do the right thing. So thank you and welcome, MPP Holland.
Good morning, everyone. It's great to be here, and thank you, Rhonda, for that introduction. It's good to see you and your team again as we make this announcement on improved healthcare for Northwestern Ontario. I'd also like to echo the acknowledgement of the lands and recognize the cultural heritage and contribution of the Indigenous peoples in Northwestern Ontario. It's always a pleasure for me to be at Thunder Bay Regional and spend time with the good folks here. To grow and develop meaningful working relationships with Rhonda and her team over the past year and a half has indeed been a privilege for me. These connections have been crucial to enabling honest dialogue about the complex healthcare needs in our community and region. It's very important for me that we continue relying on each other, working together towards our common goal of meeting the best interests of all people who seek care and services through the hospital. This common goal and a commitment to narratives rooted in facts and data will anchor us during times of challenge and uncertainty. As you know, Thunder Bay Regional Health Science Centre is a hub for residents across all of Northwestern Ontario. And those who attend here in search of help experience any number of issues and life situations. And it's for this reason our government has recognized the value in stimulating and supporting innovative models of care. Today, on behalf of the Deputy Premier and Minister of Health, the Honourable Sylvia Jones, it's my pleasure to announce some important service enhancement funding for the Thunder Bay Regional Health Sciences Centre. Under the alternative level of care and patient flow discharge supports category, 3 initiatives at the regional will receive investments. To $245,200 will be allocated to the recruitment of a planner and kinesiologist, which will enhance the rehabilitation resources currently offered to patients. $347,320 will be applied to support patient-oriented discharge and post-discharge follow-up. This program supports 10,000 patients per year in transitioning from the hospital to their homes safely. And $700,000 will provide flexible funding for patients who experience barriers that prevent them from leaving the hospital. This funding is intended to address those unique situations and life circumstances not currently funded through other programs, and they could be in the form of service, supply, or even equipment-based. So today's total announcement for the regional is just under $1.3 million. Congratulations. Investments like the ones announced today shows our government's commitment to healthcare across the province, and moreover to Northwestern Ontario in particular. In the past year alone, over $29 million has been invested in healthcare in Northwestern Ontario. We must keep the door open to continue these conversations with our people and our ministers. And in this regard, I'd like to take a moment to share the gratitude of Minister Jones for the time spent with hospital staff at the roundtable in October. The minister truly valued the face-to-face sharing and learning, and is certainly impressed with the capacity of our leadership team here at the regional and across the region in general. So on behalf of our community and our government, I would like to thank the hospital staff, administrators, and the board for their compassion and dedication to the patients who look to you in their time of need. Thank you, Meg Widge, and I want to wish everyone a Merry Christmas and a safe and Happy New Year. Thank you.
So again, as I wrap up, I would just like to express our gratitude for these additional investments. They will certainly help us to ensure that our patients receive the right care at the right place and time. It's funding like this that really helps to ensure that we live up to our vision of exceptional care for every patient every time, while ensuring these necessary levels of care. So again, this concludes our announcement, and I just wanted to take the opportunity again to thank MPP Holland and your government for all of the support, and MPP Holland and myself are both available for comment, and if you'd like to join me maybe for a photo op up
What that means to people wanting to, or needing to come to the hospital, or even needing to be discharged, like what message is that?
Yeah, so the announcement of just under $1.3 million made today was under our alternative level of care stream in the Ontario Ministry of Health. And it's new funding designed to help patients and support the programs, to help the patients to get discharged from the hospital sooner and be able to get back home safely. So it's a series of announcements. There's been $131 million across the province, and this is the second in probably 3 or 4 announcements that I'll be making with different healthcare providers in the district to support them in their needs and really provide a better quality of care for the patients and be able to get them home into their own environment.
Can you be specific about what that quality of care upgrade is going to look like? If I was just a regular patient, in a hospital bed, how would it be different now that this funding is here compared to before for me? How would my experience change?
So it's just going to provide enhanced level of service and more ability for the hospital to serve those patients and be able to give them that care and get them home. As you indicated during the announcement, and Rhonda had said in her remarks as well, there's 3 streams that is being funded, and one is for a planner for a kinesiologist and a planner to help patients that are recovering from surgery receive that care and that plan to help them rehabilitate better at home.
What kind of things is the planner going to help people get connected to? How's that going to change their experience?
So that'll be something you'll have to speak directly with Rhonda about, how they're going to implement that plan and provide those services based on the funding that we're going to the hospital. We don't necessarily give them the plan. We look to them to develop a plan according to their specific needs across the province.
Do you think this is going to be more beneficial for residents immediately in the city and around versus as a regional hub?
Absolutely. We know, as I said in my remarks, Thunder Bay Regional is a hub for Northwestern Ontario. So we see those patients that are requiring these services are coming to Thunder Bay to receive those services. So this will help develop that plan, develop the supports that they need so that they can go back home and recover better at home.